All right, we'll start. All right, we're here with Mr. Morris. Mr. Morris is a patient of mine that came to see me, how long ago was it?
About two and a half months ago.
All right, and your major complaint when you came in is you had glossopharyngeal neuralgia.
Yep.
That's a lot to say.
It's a mouthful.
Yeah, it is. Why don't you tell us exactly what kind of symptoms you're having?
It was with any kind of swallowing or anything at back where the station tube comes from the ear down into the throat. From there up into the ear, I was having excruciating stab pain, burning pain straight up into the eardrum.
And how often was that happening to you?
Rather frequently, with trying to get the medicine level up again to where it would get it back under control.
Well, the doctors put you on what, Tegretol for that?
Tegretol. I initially had been on carbamazepine.
Right.
And I've been on it for about 8 years.
Did you have any problems taking that medicine? Because it's got a lot of side effects.
No.
So you had none at all?
You know, right now with the Tegretol, I'm having problems with my sodium level.
Yeah, well, that's very common with that medicine.
Yeah. But with the Tegretol, other than just periodically, we've been having to go up on the dosage level.
Right. Well, tell everybody, when you came to see me because you're thinking about having surgery to have this thing fixed.
Consult again, to consult surgery to alternative to fix it. So because the medicine at that point was not controlling.
Okay.
Even though the increased dose was not controlling the pain.
Usually this kind of surgery for neurosurgery, we usually make a small incision behind your ear and go in and put a little sponge between the blood vessel that's pushing on the the ninth cranial nerve. And it's a big, risky operation. You know that because you kind of work in my field. So why don't you tell us what I told you back then and what we did?
At that time, you explained that the side effects and the possible problems would be, worse than possibly with the medications. It might not necessarily correct the problem, and so that an alternative would be going with a special diet and vitamins that would possibly correct the problem.
Right, and that special diet's the Paleolithic diet with a lot of seafood.
Seafood, which I love my shrimp and the seafood, so I didn't have any problem with that.
And I'll also put you on high dose vitamin K2.
Vitamin K2, and within probably a week to 2 weeks, I was pain free. Have not had any symptoms or problems since then.
That's awesome. I mean, I know how debilitating. You know this because we had talked when we first met that I have a couple patients that also have trigeminal neuralgia, and we're doing the same protocol on them, and they're getting the results too. Some of the things that I'm doing in those patients, I'm actually adding ice to their regimen on the side of their face. That actually extends the pain relief. Since you got better just eating all those shrimps and using the K2, I'm inclined probably not, to push the ice on you. But if you say, hey, doc, I want to try to push the envelope here and maybe get off the Tegretol, guess what I'm going to tell you? I think you need to start considering putting ice right at the angle of your jaw right here, probably an hour or two at night, and that's it. I wouldn't expect you to do anything else, but I think we saved you a craniotomy, and you're probably not going to have to do surgery for this.
Sounds like a really good thing for me, and I'm really excited with that because I was not looking forward to any time.
Most people aren't looking forward to having me opening up their coconut. That's for sure. No. Well, I'm glad you shared this with us, and I'm sure you're going to be able to help a lot of people too.
Good.
Thanks.